If you're on medications for urinary incontinence and you are frustrated by the side effects, the dryness everywhere, not just down below, then this video is for you. My name is Brittney Capiello, and I'm a pelvic floor physical therapist who's devoted her entire career to helping women just like you. So let's talk today about medications and incontinence. Yes, there is a time and yes, there is a place where medications can be super beneficial. Oftentimes when I see women either in my online program or I see women one-on-one for consultations, we will talk about medications for incontinence and whether or not they've tried them, whether or not they're currently using them, and sort of what is the plan. Because ultimately, as a pelvic floor PT, I want to get your pelvic floor strong enough so that you don't have to stay on medications. But medications can be super helpful, at least in the early stages. So often when clients are coming to see me and they're wondering if they can ever get off of them, my first answer is absolutely yes. But what a lot of times I will do is I'll say to them, why don't we have you stay on your medications while we're starting to improve your pelvic floor strength? That way you're not suffering from embarrassing leaks or having any issues regarding pads or liners or full bladder loss while we're strengthening your pelvic floor. And then what I do is I work with them and with their doctor as we go through our course of treatment. As I start to notice them getting stronger, they're getting better with their home exercise program, things are moving better, their strength is looking better, their core abdominal strength, extra support for their bladder and internal organs is getting better. Then we'll start talking with their doctor about weaning them off the medications. As a physical therapist, I cannot make those recommendations, but working with your doctor, we absolutely can. So in many cases, I am able to take women from coming in, being on bladder medications, to being off of them as they progress through their exercises and their physical therapy treatment with me. So if you're wondering if it's possible to get off of them, yes. There are exercises you can do. There are ways that you can take control back over your body without the need for pharmaceuticals. They have a place. They can be beneficial. They can even be beneficial, sort of like having a crutch in the beginning after fracturing a leg, right? So the crutch helps you sort of start to get moving again, start to get things going again. Maybe you're partial weight bearing, you're starting to get some strength back in that leg, but eventually you've got to ditch the crutch in order to get that leg strong enough for you to walk without it. Think about pelvic floor PT as being the same, and think about the meds being your crutch. So they help you a little bit along the way, but once we get you stronger, we can start weaning them off and get you off those medications completely so that you can control your bladder and so that you can live life without worrying about side effects from medications and without worrying about pads and bladder leaks. Hope that helps. If you're looking for more information on how to stop your bladder leaks, check us out at mycorefloor.com.